Hello, everyone. My name is Karla Salas, and I am the head of the quality unit at the University Hospital of Valdebron in Barcelona, in Spain. And today I will be discussing with you shared decision making, that is an essential model for modern healthcare that moves us towards a more patient-centered approach. This presentation will cover 3 points. I will explain first what shared decision making is and why it is important. Then we will explore how this process is applied in real-world clinical settings. And finally, I'm going to talk about where are we in our hospital in this point. So, shared decision-making is a collaborative process where both the patient and the healthcare professional share information and work together to make the best decision for that patient. The patient provides their preferences, their values, and their personal context, while the professional provides medical expertise. Together, they reach the best decision. Shared decision-making is particularly valuable when there are multiple treatment paths, at least 2 options, and patient preferences play a large role in choosing the best one. In clinical practice, we mainly have 2 types of scenarios. The first one is where we have the balance between benefits and risk is clear, and the confidence in the evidence is high or moderate. There are scenarios where strong recommendations can take part, and when we ask patients what their preferences are, most of them will choose the same option. In these strong recommendation scenarios, it is not necessary to perform shared decision making. In these scenarios, we just have to decide and act. Just do the things we know we have to do. And in the weak recommendations scenarios, there are unclear balance between the benefits and risks, or there is not enough evidence of the literature, the studies. We have low or very low confidence in these studies. And when we ask patients what will they choose, there are a lot of variability between their decisions. So in these weak recommendation scenarios, it is recommended to perform shared decision making. But this is a concept, theoretical concept, and we need to apply this in the clinical practice. How we apply shared decision making in clinical practice. There are some tools that can help us apply shared decision making. They are known as patient decision aids. And these are evidence-based tools designed to help patients understand their disease and their treatment options. These tools provide clinical evidence in a way that it's accessible to patients, helping them understand the risks, the benefits of each option. It could be, these decision aids can come in different formats, like papers or videos or platforms online or on an app. But the principal aim is that they standardize information, that make accessible information, and they can help patients to communicate their values and preferences. These aids, these patient decision aids, have a lot of evidence behind them. Research on patient decision aids has been covered in a systematic review published by the Cochrane Group, and there is enough evidence that these aids improve the knowledge of the treatment options, the accurate perception of risks. Patients can take a more active role in decision making, and they reduce the decisional conflict. So these tools, these decision aids, need to be performed in a very rigorous way to ensure us they have quality. There is an international collaboration called International Patient Decision Aids Standards Collaboration, the IPDAS, that has developed some criteria so we can ensure that these tools reduce the risk of bias in decision making. But how our healthcare professionals can perform these both concepts, shared decision making and patient decision aid in clinical practice? There is the Elwin's three-talk model that outlines a structured consultation process for shared decision making. It focuses on three talks: the team talk, where professional and patient agree to work together as a team; the option talk, where the professional presents the different treatment options and they discuss the pros and cons of each option; and finally, the decision talk, where the patient expresses their values and preferences, and both together, the patient and the healthcare professional decide the best option for that patient that is aligned with their values and preferences. This shared decision-making process ensures that both patient and professionals are on the same page throughout all the decision-making journey. At Vall d'Hebron, at our hospital, we have implemented a 6-stage process for shared decision-making. It starts with identifying the decision to be made, followed by developing the necessary aids to facilitate this process. All of this model is co-created with patients. It's really important to have patients in the group of the working group from the beginning, not just when we have the product. We need to include them from the beginning. The next step is how we identify the possible barriers that we can have during the process. One of them is culture and training. So this is the 4th stage when we perform the training in healthcare professionals to use the patient decision aids and also to understand the whole process of shared decision making. Finally, we implement this process in the clinical practice following the 3-talk model, and at the end we analyze their impact on patient health. Now in Vall d'Hebron, we have deployed this process in 5 clinical areas for now. We have it on morbid obesity, advanced chronic kidney disease, multiple sclerosis, induction of labor, and finally on breast cancer. For breast cancer, we are focusing on women that are at high risk, so we want to work to implement shared decision making in their early treatment discussions. For now, we are reviewing the evidence and the available tools, available patient decision aids, and we aim to fully integrate the shared decision-making process by the end of this year. So for conclusion, I will need to highlight that it is really important to have a structured model that facilitates the implementation of shared decision-making in clinical practice. Shared decision-making enhances patient satisfaction, patient experience, improves our patients' knowledge of their disease and their options, and strengthens the relationship between our patients and our professionals. And it is really necessary to move forward this way of practice to offer our patients the best personalized and effective care. So thank you very much for your attention, and